If you have hip arthritis, you're probably wondering what treatments can help you get relief without surgery. Well, there's good news. There's a few different options that might help you. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I hope you feel, look, and perform your best regardless of age or injury. Hip arthritis is an extremely common condition. It affects millions of people across the country and across the world every year. And it can be debilitating and really hard to manage. But fortunately, there's many different things you can try before you resort to hip replacement surgery. Let's start with the obvious one, anti-inflammatory medications. There's both oral medications, pills that you take, and then topical ones, creams or gels. These drugs can reduce pain, they can reduce inflammation in the hip, which potentially means they can be helpful for some people with hip arthritis. They work by releasing or preventing the release of certain enzymes in cells that cause inflammation and hence pain. Now, there's a limit to how much of those medications a person can take, and they do have side effects, so they may not be great long-term options for some people. The next treatment option would be physical therapy. Physical therapy, I'm a big fan of. It involves exercises to strengthen the muscles around the hip joint to take pressure off the damaged bone and cartilage. The physical therapist will work with you to improve your hip range of motion to make it easier to do what you need to do every day. And it's best if you do those exercises, at least at first, under the supervision of a physical therapist, so you learn to do the exercises correctly. They can also look at the exercise you want to do, the sports you want to do, the daily activities you want to do, and show you ways to modify those activities to minimize your pain while doing them the way you want to do them. And finally, if you're looking to avoid a hip replacement and you're willing to consider treatments that might be experimental or used off-label, regenerative medicine has a number of exciting treatment options. There are a variety of supplements and medications, peptides, PRPs, stem cells, exosomes, and many, many more. I could go on and on. Sometimes used in isolation, I usually recommend a combination of treatments to decrease pain, improve function, and hopefully allow you to do what you want to do as well as you want to do it for as long as you want to do it without surgery and without cortisone shots. I'd love to hear about your hip pain or your hip injury. Leave those in the comments below. I do read those comments, but just understand I can't legally offer you medical advice online, so I rarely respond to those comments, but I do try to answer those questions in future Ask Dr. Geier videos. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and start another live stream, including my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.